So Oviva is a provider of technology-enabled behaviour change services, and we work with the NHS to help people who have conditions like diabetes and complex obesity to lose weight, and we use technology to make those services more efficient and also more effective. So one of the biggest challenges that we see in healthcare today is access to services. So with face-to-face programs, you have issues about travel, you have issues about finding childcare, you've got people who work, and all of those things mean that people can't engage in traditional services. So lots of people who really need help with changing their behaviours, maybe they have diabetes, and they don't actually have anything available to them to help them change their behaviour and improve their health. So I think digital is going to be crucial to enabling that. And it does sort of two things. It means that people can access education and information in a time that suits them. And secondly, it means that people can do self-monitoring so they can see how the changes in their behaviour are improving their health and maintain that in the longer term. So in today's workshop, the main things that I focused on were the very small increase in public health that we've seen since 2000 versus the total healthcare budget, and also the challenge of access in terms of services. And what we need, or sort of what the key point is, we need to have new ways of commissioning services, and we also need new types of services to be able to help people who can't access existing care. And then I also covered what Oviva do. So for example, our diabetes structured education program, and that's looking at how do we help people with diabetes reduce their HbA1c, and demonstrating how we've managed to widen access and improve outcomes in that group. So I think there are three things that are really exciting that we're part of at the moment. One is the NHS England Diabetes Prevention Programme digital pilot. So that's going to be looking to see if remote and digitally enabled solutions are effective in treating people with pre-diabetes. The second one is working in Buckinghamshire, when we're part of a single point of access where we work alongside face-to-face services, and we're looking at how we can increase access to groups who aren't traditionally accessing services. And then the third piece is we're working in specialist weight management, or tier 3 weight management in Wakefield, and it's the first tier 3 service in the country that is using digital as part of the care pathway. And so we're going to see if that can help increase, again, access and outcomes in that group of people. I think it's been really great from meeting such a diverse group of people across the public health sphere and the CCG sphere in terms of long-term conditions. I think the thing that I've mostly been encouraged by is a lot of the people working in public health and in health and wellbeing boards sort of are already doing technology and are already thinking about new ways of commissioning and thinking about how health and public health works together. And so we would love to, continue to work with those people to see what we could do.